the non-communicable diseases and its risk factors in adolescents. So this is definitely close to my heart topic because I think we needs to catch them young. If we catch them young, we can educate them, we can prevent non-communicable diseases, especially on the adolescents, without losing focus on what Dr. Parekh has discussed, that is in the mother's womb also. Next. Next. So I start this lecture by paying tributes to my late father, Comrade Ved Prakash Gupta, my friend, mentor, guide, Dr. Gurpreet Singh Wander, for my academic accomplishment. Without his motivation, I could not have reached here. Next. So coming on to the topic, so that is adolescent. What is adolescence? Adolescence is a transitional stage of growth and development, and WHO defines it between age of 10 years to 19 years. And this is supposed to be the crucial time for laying foundation of good health. Mind you, this statement is very, very important because biologically adolescence is mark of onset of puberty and termination of physical growth. So this is growing period, and cognitively adolescence shows improvement in abstract thinking, knowledge, and logical reasoning. Socially, the period is preparation for adult role. So these three factors, biological, cognitive, and social, forms this group, very vulnerable group as far as the non-communicable diseases are concerned. Next. So what are non-communicable diseases? These are, as the name suggests, cannot be communicated. So they are combination of genetic, physiological, environment, and behavioral factors. So that is why we call them as lifestyle diseases. And dominantly, when we say non-communicable diseases, it pertains to cardiovascular diseases, cancers, chronic respiratory diseases, diabetes mellitus, and I may add there as obesity also. Next. So list of non-communicable diseases also include neurological and mental health diseases, digestive diseases, musculoskeletal diseases, chronic kidney diseases, and autoimmune conditions. Next. Epidemiologically, non-communicable diseases present a formidable public health challenge in India, especially among youth, because that is the foundation, and a poor and deprived section of society. This becomes a great public health challenge, and notably surge in mortality and morbidity is there. And ICMR data shows doubling of NCD burden among population age between 15 to 29 years over past decade. So this is a very, very important and grave issue that in India there is doubling of NCD burden among the youth. Global burden and disease study also attributes about 23% of NCD related mortality and morbidity among India's youth. Next. So several risk factors can be there in contributing to development of non-communicable diseases. So they can be classified as non-modifiable risk factors and modifiable risk factors. Next. Non-modifiable risk factors include family history and genetics, race and ethnic background, age, gestational diabetes. So gestational diabetes is supposed to be the risk factor for all cardiometabolic disorders later in life. So as Dr. Parekh has discussed, we should take care of women during pregnancy so that we have healthy offsprings. So that is how we can decrease the prevalence of NCDs later in life. Next. So modifiable risk factors can be classified into metabolic and biological, which include excessive weight and obesity, hyperglycemia, hyperlipidemia, and raised blood pressure. Behavioral factors include unhealthy diet, tobacco use, physical inactivity, and harmful use of alcohol or other substances. I think India should focus on behavioral factors which are leading to the other factors also. If we control behavioral factors, we will be able to control metabolic and biological factors and societal factors also, which include complex combination of interacting socio-economic scenario like poverty, low public health care spending, and limited access to services. So during these factors, if we discuss social factors, they can be eliminated by only awareness and education. Environmental parameters, climate change, sunlight, and air pollution are emerging risk factors which need to be taken care of. Next. So importantly, it is estimated that NCD deaths can be prevented by eliminating the four important metabolic behavioral factors. So that is what our focus will be on: unhealthy diet, physical activity, tobacco use, and misuse of alcohol. The social, commercial, and physical environment are key drivers for these behavioral factors. So these behavioral factors, in fact, lead to all the non-communicable diseases, and when they are encountered along with social, commercial, and physical environment, the dangerous effect of these four risk factors increases beyond imagination. Next. Poor eating and unhealthy diets under the hypnotizing influence of commercial and promoting ultra processed foods containing high level of saturated fats, trans fats, sugar, salt is on rise among adolescents, leading to weight gain and adverse metabolic change. Physical inactivity, insufficient physical activity, and unhealthy sedentary behavior is increasing, especially with academic stress, social media use, lack of open spaces, promoting exercise, and rapid urbanization. Amongst 90% of adult smokers began smoking before the age of 18. So that is why we are talking about adolescence, because that is where the habit forming attitude is there. And 1 in 4 adolescents who smoking start tobacco before the age of 10 drastically increase the risk of NCDs and its complications. Adolescents who began drinking earlier are more likely to become dependent on alcohol within 10 years than those who begin drinking at the older age, causing increased factor of premature death, disability, road traffic accidents, unprotected sex, intentional and unintentional injuries, poor mental health, etc. Next. So behavioral risk factors contribute to four metabolic changes that increases the risk of non-communicable diseases that include high raised blood pressure, that is what we call as hypertension, overweight and obesity, high blood glucose levels, including pre-diabetes and diabetes, and abnormal blood lipids. In terms of attributable deaths, high blood pressure is contributing to about 25% of global NCD deaths, and raised blood glucose and overweight and obesity are the root cause of other complications which are encountered in almost all the non-communicable diseases, where I think overweight and obesity is root cause. Next. So if we go by statistics, the ICMR and DAP study is a great study which tells us about the prevalence of diabetes is about 11%, pre-diabetes 15%. Look at the hypertension, it is about 35%. Generalized obesity is about 28%. Abdominal obesity, which again is an important risk factor, is about 40%. And dyslipidemia is 80%. And all metabolic non-communicable diseases except pre-diabetes are more frequent in urban areas than rural areas. But I must say, with urbanization of rural areas, the penetration of consumerism in rural areas are fast catching the prevalence of NCDs in urban areas. So we should not today distinguish between urban and rural. We should focus on the risk factors which are as prevalent in urban as prevalent in rural areas. Next. So why India is different from other Western countries? So there are key features. First is early onset. Non-communicable diseases tends to develop early in India. Increased burden. There is high burden of non-communicable diseases. Significant proportion of deaths are attributed to non-communicable diseases. As I have told in the previous slide, the rural areas are catching up with the urban areas. Socioeconomic factors like poverty, poor sanitation, lack of access of healthcare, traditional diets play a role in higher prevalence of non-communicable diseases risk factors in India. High prevalence of risk factors, so there is clustering of risk factors. A person is having more than one risk factor, what we call is a clustering of risk factors, including tobacco use, unhealthy diet, physical activity, and obesity. Gender disparity is there. Men are more likely to be exposed to risk factors than females. Next. So key factors. What we are talking about today is adolescents. So prevalence of NCDs in adolescents is increasing, experiencing conditions like hypertension, diabetes, chronic lung diseases. When we were students, hardly any youngster less than 40 years of age, I must not say that young, but they were having hypertension or diabetes. Now it is very frequently we see that hypertension, diabetes, cardiovascular diseases, chronic respiratory diseases are prevalent in younger population. So much so that prevalence of hypertension among adolescents is noticeably high. So that is about 4.5%. And concerning percentage of obese adolescents, more than 25% by age of 15 exhibit early signs of diabetes, that is pre-diabetes, and cardiovascular risk factors, again, 70% are having one or more risk factors for cardiovascular disease by the age of 20. So we need to consider the increased prevalence of risk factors among adolescents leading to early exposure to non-communicable diseases. Next. So the risk factors in adolescent increase the risk factor of non-communicable diseases impacting health throughout the life course. Among adolescents, physical inactivity and sedentary behavior has been linked to increased obesity and adiposity, poor diet, depression, and reduced quality of life. Globally, unhealthy diet, mainly from consumption of sugar sweetened beverages and saturated fats, increases the risk of CVDs. The NCDs during childhood is linked with behavioral risk factors established early in life, and around two-thirds of the premature deaths in adults are associated with behaviors adopted during adolescence. So that is why we should target adolescent period for prevention of non-communicable diseases in future life of adults. Next. Next, please. So why adolescents are important in control of NCDs? So that is what we have been talking about. We all know prevention is better than cure. So it is wise to prevent NCDs by all means. And prevention of risk factors in young people is likely to be more effective. Adolescence is probably the last best opportunity to build positive health habits to limit harmful behavior. Adolescence is an age of developing brain and time for habit formation. So again, this line gains importance more than life. That is the period where you can modify their habits, and educating adolescents, making them aware of the dangers of future life non-communicable diseases may help us change their behavior and habit formation during that period, and habits adopted during this time are likely to persist in adult life. So if we have positive health attitude in adolescent period, so that positive health attitude will be continued in adult life, and that is the important way to protect or prevent NCDs in future life. Importance to detect and manage harmful behavior related to NCDs during adolescent period gives us an ample opportunity for prevention of NCDs later in life. Next. So this again question gains importance while adolescent is critical period for NCD prevention, because behavioral patterns are established during this period. Many lifestyle habits, both healthy as well as unhealthy, are formed during adolescence and tend to persist into adulthood. Peer influence is great factor. Adolescents are highly influenced by their peers, which can impact their choices regarding diet, physical activity, and substance use. Substance use in Punjab is gaining, monstrous proportions. So we must take care of adolescents' education and awareness part. Long-term health consequences, risk factors established in adolescence can significantly increase likelihood of developing NCDs later in life, leading to premature morbidity and mortality. An opportunity for intervention is a golden opportunity that adolescence presents a crucial window for implementing preventive interventions aimed at promoting healthy behavior and reducing exposure to risk factors. I think whole of the lecture is focused on this slide only, that we should take adolescence is a critical period and long for or try to change their behavioral pattern, peer influences, leading to prevention of long-term health consequences. And this is the best opportunity for intervention. Next. So impact of NCDs of youth in India. Physically, NCDs exert a profound toll on physical health of young individuals. Socially, they impose significant challenges on youth, fostering stigma, discriminating, affecting mental health and well-being, disrupting educational opportunities, contributing to social isolation and economic adversity, particularly in deprived, facing barriers of constrained healthcare access. Economically, NCDs adversely affect the national economy, the youth being high healthcare cost, loss of productivity due to disability, premature mortality, and absenteeism. So that is how NCDs are affecting our youth in India. Next. So primary prevention of NCDs includes factors related to cultural and behavioral factors, dietary habits, physical inactivity, tobacco and alcohol use. That is what the four highly important risk factors we have been discussing. Socioeconomic factors include economic disparities, education, lack of healthcare access. Next. Healthcare system challenges are great in a poor country like India. That is preventive care. Limited focus is on preventive measures and early detection. And I must congratulate this group for focusing on preventive measures. Allocation resources, insufficient resources are allocated for NCDs in public health, but the allocation is increasing with Indian nation more focusing on LCDs and its prevention. Healthcare force shortage of trained healthcare professionals and specialists. Environmental factors are gaining importance in recent years, that is pollution and urbanization. And most important is policy and implementation, regulatory framework. There is weak implementation of policies related to tobacco, alcohol, and food industries. So we have been running a campaign against food industries for front of the pack warning labels, so that each and every individual should get to know what they are eating and they can decide the harmful effects of those ultra processed foods. Especially public health initiatives need to be more comprehensive and coordinated to meet the public health challenges. Next. Intervention and strategies for prevention and control of NCDs among adolescents in India needs to focus on promoting healthy lifestyle, ensuring early detection, expanding healthcare access, and health promotion initiatives aim to instill habits of balanced nutrition, regular physical activity, and avoidance of substance harmful to health like tobacco and alcohol. Strategies should include school-based educational program, community outreach efforts, extensive media campaigns, all designed to foster the healthy lifestyle choices among young people. So we should need to focus on women as well as adolescents for any preventive strategies for non-communicable diseases. Next. Early detection of NCDs is very, very important. Improving healthcare access involves establishing dedicated NCDs clinic, behavioral intervention focusing on counseling, motivational interviews, peer education can effectively promote positive healthcare behavior and reduce NCD risk factors. Policy implementations are always the basis of for implementation for nation, emphasizing on prevention, early detection, management. So that is for prevention of NCDs, strong tobacco control, and financial protection for adolescents can alleviate economic burden of NCDs from the families. Next. So, my dear friends, preventing and managing NCDs in India among adolescents involves tackling a complex interplay of cultural, behavioral factors, socioeconomic factors, healthcare system challenges, environmental factors, and most importantly, I have been stressing it for long, policy and its implementation. Next. So, take home message will be burden of NCDs and its risk factors is significant and is increasing in India. We are affected at very early age with clusters of risk factors, various cultural, socio-economic, and systematic challenges are crucial for prevention of non-communicable diseases. Addressing these challenges require a multifaceted approach involving public health interventions, lifestyle changes, medical management, community initiatives like this, what we are conducting now, public health campaigns, healthcare system strengthening, and promotion of healthy lifestyle and behavior from childhood. Implementing comprehensive strategies that target prevention, early detection, and management is really, really important. Next. Prevention and control of NCDs among adolescents has emerged as a global priority. To encourage prevention and control of NCDs risk factor early in life, WHO has recommended a package of integrated approach in school health program. Indian national strategies are being implemented for prevention of NCDs, stressing upon preventing and controlling NCDs during adolescence. Lancet Adolescent Commission identified tobacco use, alcohol consumption, overweight and obesity, and mental health issues as major risk factors among adolescents around the world. It is important to understand the Indian differences in clustering of NCDs risk factors in adolescents and to inform local context specific prevention priorities across region. So it is not one fit all strategy. We have to consider our cultural, social factors, the regional factors for implementing the NCDs prevention program, especially focusing on the risk factors prevalent in that region. Next. So thank you very much. With this, I invite you to 12th Annual Conference of Association of Physicians of India in September at Bathinda. And we have published a book on pollution and health, which is being distributed free of cost. You can access the PDF copy at our website, www.apimalwa.com. Thank you very much for providing this opportunity to talk about adolescent health and prevention of NCDs. Thank you very much.